3 this morning. We have learned this week that there are new concerns about cancer in young people. An American Cancer Society study found millennials born after 1990 have double the risk of colon cancer and quadruple the risk of rectal cancer compared to baby boomers. Dr. Marianne Ritchie from the Sidney Kimmel Cancer Center joins us to expand more on this. I think every article I read, when people are saying, oh my goodness, and the question is why, no one knows.
Well, thank you for having me for starters. And I brought you both little treats, colon cancer awareness bracelets.
Beautiful. Thank you, thank you, thank you.
They're from Tiffany's. But it's so important because there are campaigns such as the Pink campaigns, and the awareness of breast cancer is out there.
Yes.
But we're working hard to get colon cancer awareness in the news because it is the #2 cause of cancer death. And as we see this rise in 2 types of cancer, the large intestine is made of the colon, which is about 5 feet long, and then the 6-inch portion at the very end is the rectum. 2 slightly different cancers treated slightly differently. But what we're seeing is this, as you said, if my son was born in 1990,
right.
So his risk now at almost age 27 is double the risk for colon cancer, quadruple the risk for rectal cancer as those who were 27 if they had been born in 1950.
Why?
Well, it remains to be seen because obesity, sedentary lifestyle, these things that are blamed for colon cancer in general, and we see this age group that's parsed from people over age 55.
So it's scary to think about, and then you want to think, well, what do I look out for? What are the warning signs? What are they?
Well, unfortunately, when young people are diagnosed, it's later because we don't suspect it. You know, when the primary care docs see them say, oh, it's probably something friendly, like a hemorrhoid or food poisoning or such. But if you have the symptoms persist, and that could be anything from persistent belly pain, unexplained weight loss, rectal bleeding, and a lot of times people are told rectal bleeding, it's not normal to have rectal bleeding. It can be something innocent, like hemorrhoids, but you don't know.
Right.
And so the gold standard for testing patients is the colonoscopy. Colonoscopy, we go in. My job as a GI doctor is to go in, find polyps, which are benign growths most of the time, take them out before they turn to cancer, or find early cancer when it's more treatable. Young people, delay in diagnosis is harder to cure. It's heartbreaking.
And it's tough because when you're young, you think you're sort of invincible.
Yeah.
Yes.
That's your feeling.
I'm a big, superfood type of guy. Is there anything like prevention, anything that you would recommend?
There are studies that suggest that fiber has an anti-inflammatory effect. High fat seems to change the characterization of our bile and our bile acids, which anti-inflammatory seems to be key. Fiber seems to cause prevent inflammation, and high fat seems to cause hypercell activity.
Okay.
But we have conflicting evidence about these things.
So we have to stay on top of it. So you gave us blue bracelets.
Oh,
You
yeah.
have on your blue dress. There's a blue lights campaign throughout the city. Talk more about that really
What
quickly.
about my blue tie?
Oh, I forgot. Your blue tie and your blue
Excellent.
suit.
The whole idea that what has got, I've been doing gastroenterology for over 30 years. I trained as Sloan Kettering in the Cancer Center. Pink is great because, you know, so many women are affected by breast cancer. 1 in 8. But what people need to learn is 1 in 3 people over age 50, 1 in 2 people over age 60 get colon polyps. Not all polyps go to cancer, but cancer always starts as a polyp.
Right.
And so the Blue Light campaign is to bring that message out to people. African Americans should start screening at age 45 as per our national society, the American College of Gastroenterology. And the other thing I started is because women think mammogram is done. Colon cancer is a men's disease. No, it is equal in men and women. We have a program at Jefferson called Pink Plus. When you come for your mammogram, let's talk colonoscopy. When you come for your GYN exam, let's bundle those 2. 1 night a month, I bring a gynecologist with me. Women get their mammogram, gynecology exam, and they talk to Dr. Ritchie about that little colonoscopy. It's not fun, but
we have to do it.
Guess what?
Good.
Drink the goo. It's better than radiation. It's better than chemotherapy. And it's better than
Absolutely.
Fear Factor. Let's do this.
It's better than cancer.
I
We
like
love
her.
that. Thank you, Dr. Ritchie.
Thank you.